Hello and welcome to This Week in Global Health. My name is Katie Jackson and I'm reporting to you live from Stockholm. Today we're going to do a roundup of news stories this week, May 8th at the end of the week, so the stories of the past week. And I have some guests with me here as well, so if they'll go ahead and introduce themselves.
Hey, my name is Raul Ahuja, and I'm reporting from Charleston, South Carolina.
Hi, I'm Angelica Hardy, and I'm reporting from Cleveland, Ohio.
We're all very official today with our reportings. Diving right in, I'm going to start with the first story. So basically, one of the stories that came out this week was a new study has suggested that the health benefits we get from cycling and walking do outweigh the harmful effects of air pollution, despite worldwide concerns. Researchers from the University of Cambridge found that air pollution contributes to 40,000 early deaths each year in the UK, and according to the WHO, urban outdoor pollution worldwide is estimated to cause 1.3 million deaths per year. Dr. Mark Tainio, the lead author of the study, said that even in Delhi, one of the most populated cities in the world, with pollution levels 10 times higher than those in London, people would still need to cycle over 5 hours per week before the pollution risks outweigh the health benefits of the exercise. Yet those that have a 30-minute commute each way on a bicycle are almost hitting that dangerous level where the health benefits may not be as beneficial to their health, due solely to air pollution, and as we take in more air as we exercise. Action is still needed. The average air pollution level for cities around the globe is 22 micrograms per cubic meter, according to the WHO. In London, the air pollution level was recorded at 16 micrograms per cubic meter in 2011. Senior author Dr. James Woodcock added, whilst this research demonstrates the benefits of physical activity in spite of air quality, it is not an argument for inaction in combating pollution.
Thank you, Katie. And speaking of clean air, let me talk about a very interesting new piece on tobacco control legislation from the United States. So, California now will become the second U.S. state after Hawaii to raise the minimum smoking age from 18 to 21. So, what's really interesting is that last year, the Institute of Medicine released a report that concluded that if states raised the minimum tobacco age to 21, there would be a 12% drop in the number of teen and young adult smokers. Now, many people will argue that this policy wouldn't change anything, that because the 18 to 20-year-old age group could simply just ask somebody older than 21 to buy them cigarettes, that it wouldn't change anything. But the research shows that not everyone in that age group always goes that extra step, and not everyone is always able to find an older adult to buy them cigarettes. And given that 90% of people start smoking before the age of 25, it really underscores the importance of this policy. And not just that, tobacco is the only legal product which kills half of its long-term users, according to the WHO. It's a major risk factor for chronic diseases like cancer, cardiovascular disease, chronic obstructive pulmonary diseases. These are all the leading causes of death among Americans today. Let me again emphasize, tobacco use is the leading cause of preventable death in the US. And so stopping even a small percentage of people from starting smoking will save literally thousands of lives. Now looking forward, supporters of the legislation hope that it will accelerate similar efforts in other parts of the country and save even more lives.
That's awesome, Raul. Thanks for raising the point of how stopping or increasing the smoking age will actually reduce a large number of young people from starting smoking. So other preventable methods don't have the same success rates or great success rates. Abstinence fails to prevent HIV. We know that. But researchers at Stanford University School of Medicine compared countries that received the abstinence education funding from the 2003 U.S. President Emergency Plan for AIDS Relief, or PEPFAR, with those who did not. The results showed that there was not actually a difference between the behaviors associated with higher risk of HIV. The behaviors included things like having the first sexual experience, the number of sexual partners, or the age of teenage pregnancy. What actually worked? Girls staying in school longer, treating infection of pregnant women, yet PEPFAR still allocated about $45 million to abstinence education in 2013. So the total spent on abstinence education, or abstinence in general, to prevent AIDS in Africa is about $1.4 billion, and it has largely failed. So we will also link the Stanford study so you can learn a little bit more about what they found about the spending on PEPFAR, specifically on abstinence education. Related to sexual health, Australian government has defunded Australia's only youth-led national sexual health program called YEA. YEA stands for Youth Empowerment Against HIV and AIDS, and they have announced that the federal government has withdrawn the group's funding, and without this funding, YEA will be unable to continue after June 2016. Other countries like Australia have actually seen great success rates in reducing HIV transmission and the importance of having sexual education in their schools. At a time where young people's STI rates are at a rise and condom use is declining, the federal government has taken away money from young people trying to lead in the change that they desperately need for their sexual health education and culture. There is currently a public petition doing rounds, and the campaign is Save Yeah, with the fear of being without the resource, and young people could suffer from misinformation and perceived shame associated with STIs. If you'd like to learn more about the sexual health education in Australia, we will have the resources linked below.
Wow, that's really sad to hear that that's kind of going on right now, and I think that's really important to have youth-empowered preventative methods for global health. Moving more into the acute sphere of global health, and on our last story for this week, Médecins Sans Frontières, or MSF, has announced that they're dropping out of the World Humanitarian Summit, scheduled to take place in Istanbul later this month, saying that the summit has lost its way. MSF expressed concern that the summit will not address the major failures of the current emergency response system, particularly where conflicts and epidemics are concerned, and risks letting governments off the hook for the world's numerous humanitarian crises, and quote-unquote dissolve humanitarian assistance into wider development, peace building, and political agendas. This comes after 7 supported MSF hospitals across north and southern Syria have been bombed since the start of 2016 alone, and the bombing of MSF hospital in Kunduz, Afghanistan in the autumn of 2015, which brought around wide criticism. Vicky Hawkins, executive director of the British branch of MSF, said that this doesn't represent a disengagement of MSF from the international system, and stressed that MSF would continue to engage in plenty of international forums, from the UN Security Council to the G7. However, she claimed that there's a lack of focus on the humanitarian part of the World Humanitarian Summit. David Griffiths, head of Amnesty International Secretary General's office, said that they still have some questions about what exactly the summit is going to produce in terms of real action, but they're prepared to engage in it. We're aware of its shortcomings, but we see the devastating impact of conflict on so many places. It's good that real questions are being asked of the humanitarian system and its implementation. So the final question is, what do you guys think? Tweet us your thoughts about MSF's lack of participation in the World Humanitarian Summit or any of our stories mentioned today on the show. And you can find us on Twitter at TWiGH, or you can tweet at us with the hashtag TWiGH. So that's all for us this week. We've done a really short news update show for you guys. We hope you like it. As always, we put out these videos on a weekly basis, so please follow all of our social medias and make sure that you check back later. And that's us for this week in Global Health. Bye.